Well, Mr. Williams, we just had a thorough discussion and physical exam, and I'm thrilled in terms of how well you look.
Okay.
You're extremely healthy from my perspective. And I wouldn't recommend any additional testing at this time. I think that we should set up an appointment to come back to see me sometime in the future, but you are in great health. Do you have any questions for me about what we just did and about your health?
Well, actually, I really kind of wanted a stress test.
Mm-hmm.
5 years ago, my doctor gave me one. I was ready to start a pretty rigorous exercise routine,
Mm-hmm.
and I mentioned it to her, and she said that, it was something that she would recommend,
Mm-hmm.
and it was something that she recommended for all the patients who
Mm-hmm.
were 45 years of age.
Mm-hmm.
So one of the things that she did add was that she would recommend I do it every 5 years, whether I was
Mm-hmm.
exercising or not. And so I'm kind of reaching that anniversary, and I wanted to follow up
Mm-hmm.
and get that stress test.
Were there any issues at that time that prompted the stress test other than you're going to start an exercise routine?
No, it was just,
Yeah.
she just felt it was a good time to try it.
So you were having any symptoms that she was evaluating?
No, not at that
Nothing
time.
like that. And so she recommended a repeat every 5 years?
Yeah, kind of like a colonoscopy, I remember her saying, just to
Yeah.
keep routine.
Yeah, colonoscopy would be a different question in terms of, how often you would need it, right? Stress test is a different test. And people don't, organizations that really speak to us in terms of what we should do don't recommend that.
Okay.
Unless someone has a relatively high risk of having heart disease, right? And when I think about you, right, I mean, you tell me you run a 7-minute mile,
Right.
and there are a lot of us who are envious that you can do that, right?
Okay.
Right? That we did cholesterol as a part of your evaluation, and your cholesterol is wonderful. The low number is very low, and the high number, which is the HDL, which you want high, is 50, which is great for you, right? You don't smoke. You don't have any evidence of diabetes. You don't have a family history of heart disease. You are physically active, right? Your body habitus is excellent. Your BMI is 26, which is absolutely normal, right? So all those things would tell us that you really have a very low likelihood of having heart disease.
Okay.
So doing tests like stress tests really don't give us much in terms of information about what your heart is. And it also creates a potential for harm, right, in terms of actually people who have tests like that develop what's called false positive results, where there are abnormalities that need subsequent follow-up, and that can cause complications in that follow-up. So actually we're causing more harm to you than actually good in terms of evaluating your cardiac status. And as I think you've been told before, right, just doing a 7-minute mile is a good stress test, right?
Well, yeah.
Because if you can do that, your heart is really doing very well.
Right. Yeah, I do remember the cardiologist mentioning that to me at the time, that if I can run that break vigorously, then I probably was in good shape. But I don't know, it's just still kind of hanging in the back of my mind. So you really don't think I should get one?
No, I don't think that would be indicated for you at this point in time. I think that if you develop problems which raise a question of whether they have heart disease, then we certainly should talk about in terms of doing a test at that time.
Okay.
Right? And do you know some of the signs that you'll be looking for in terms of thinking from a cardiac perspective?
No, not really.
Mhm. So, some of the signs you look for is as you're exercising, right? If you developed significant discomfort in your chest or chest pain, right? A shortness of breath while you're exercising, which is unusual for you in terms of given your level of physical activity at this point in time. A discomfort that would go up to your neck or into your arm, right? Those would be worrisome signs that you might have something going on from a heart perspective, and you would have to call me then, right? And we would bring you in terms of evaluate you from a perspective, and probably include maybe a stress test at that time or other testing, right? In fact, what I could do is set up a return appointment for you to talk about what your experience has been, over the next month, and talk about whether you have any symptoms that really didn't come to mind as we talked about today in terms of how you're doing, in terms of we can review that, right?
Okay.
How does that sound?
That sounds good. I mean, my primary care physician 5 years ago didn't explain it as detailed as you have, nor did the cardiologist I followed up with. So the fact that we've had this discussion makes me feel less anxious and more reassured. So if you really don't think it's necessary, if you don't think it's valuable, then I'll certainly take your recommendation.
And this is an often asked question, and I have some patient-related information concerning cardiac testing and who should have it. If you would like that information, I could certainly provide it on your way out of the office today.
Sure.
And then you can call me if you have any questions about it, right?
Yeah, great.
Okay. Do you have any other concerns or issues today?
No, again, I think you've been very forthcoming, and I trust the information, and I think I feel confident about it. So
Okay.
I think I'm good.
So if you have questions, give me a call. Because together we'll deal with this as it develops. But I'm going to tell you that I think you're going to do wonderful for the next decade, at least. I can give you a guarantee for a decade.
Okay.
All right.
Well, I'll take it.
Nice meeting you.
Thank you.
All right, sir.